This is the thyroid gland. This is the hypothalamus. We have the pancreas, we have the adrenal gland, we have the ovaries and the testes for the male. These are all part of the endocrine system along with the pituitary gland. Okay? These are all part of the endocrine system. So yesterday we talked about the adrenal gland and how the pituitary gland affects it. Today we're going to talk about the thyroid gland. Okay? So one of the things that can happen, you can have a euthyroid, is a normal regulated thyroid, no problem is happening. You can have hyperthyroidism, that means there's too much T4, T3 going on. And thyroid toxicity is that overly extra, a whole more thyroid hormones such as T3, T4. Hypo meaning that it's a little bit of hormone, T3, T4. Myxedema, coma, this now is like a life and death. Either extreme can be a life or death situation. So the thyroid is located wrapped around the trachea, and what we call hyperthyroidism is a lot of T3, T4 level within the body. So a sustained increase in synthesis of thyroid hormone by the thyroid gland, and a couple of things can cause that. It occurs more often in women. The highest frequency is between age 20 to 40. One of the most common type of hyperthyroidism is Graves' disease. So let me say this. Graves' disease is an autoimmune disease. Okay? Auto means self, a disease where the body is attacking itself. One of the organ that Graves' disease attack is the thyroid gland. And when it attacks the thyroid gland, it stimulates it and it produces more thyroid, resulting in hyperthyroidism. So one of the most common form of hyperthyroidism is Graves' disease. They love to ask that in test question. What other things can cause it? It could be toxic nodule goiter, where you have a swelling in the neck. It could be infection, thyroiditis. It could be excessive iodine uptake. It could be a pituitary tumor. Remember, the pituitary glands, they secrete hormones that stimulate all the other hormones in the body. So thyroid cancer related to the effect of thyroid hormone excess. Someone who has thyroid cancer, what happens when they have an extreme amount of T3, T4, which is a thyroid hormone in the body, it increases metabolism. That's what the thyroid does. So it regulates temperature, it regulates heart rate, it regulates all the other parts in the body. Metabolism, here's what metabolism reminds me of, or the thyroid. It's like you have a ship, and ship that is run by a coal. I don't know if you ever see some movie yet where they have to put coal or wood in the fire to fuel the ship to sail. This is what the thyroid is. The thyroid is a metabolic factory of the body. If we don't have enough thyroid hormone, we're going to be tired and weak a lot of times, constipation, we're going to be cold. But we have too much, our body's going to be hyper. Everything is going to be working fast. We may have diarrhea, increased heart rate. So think of the thyroid as the gland in the body that is responsible for the metabolism in the body. It increased tissue sensitivity and sympathetic hormone system stimulants, such as I tell you, the heart rate, the GI system. So a goiter is a swelling around the neck. So you want to make, when you're doing the assessment, you want to look if there's a swelling, and in this person there is. You want to auscultate if you hear any kind of swishing sound, any bruits that's taking place. One of the things that can occur because of hyperthyroidism is thyroid toxicosis. This is a physiological effect. What this does is a syndrome of hypermetabolism. This is where everything is going out fast, remember that the thyroid is responsible for increasing, for regulating metabolism. So when you have too much, you're going to have hypermetabolism taking place. Now, what happens that causes a thyrotoxicosis? It's because there's an increase in T3, T4. I'm going to do a drawing for you to show you something. Let me get my pen. Here is the thyroid gland. Okay, it kind of looks like a butterfly. My drawing is not that great. Here is the thyroid gland. Now here is a pituitary gland. This works in a negative feedback. What a negative feedback is something similar like our thermostat in our house. For example, we will set our thermostat at, say, 75. If the temperature in the room is like 80, the air conditioner will turn on because we set it at 75, and it will cool the house down until it gets to 75. Then the air conditioner shuts off. As the room gets warmer, then the machine or the air conditioner turns back on. It's in a similar fashion in how the thyroid gland and any other gland in our body works. So let's look at this. Here's the pituitary gland. This thyroid produces T3. This thyroid gland produces T3 and T4. This is what is used to regulate metabolism. When this hormone level drops low, a signal is sent into the body. A signal is sent into the body. When the T3, T4 drops low, a signal is sent to the pituitary gland. Say, hey, we're low. The pituitary gland sends what they call TSH. TSH is thyroid stimulating hormone. It actually stimulates the thyroid to produce T3, T4. So again, the thyroid produces T3, T4. When this level is low, either one or both are low, a signal is sent to the pituitary gland to send thyroid stimulating hormone. It stimulates the hormone to produce T3, T4. Okay? When this level is increased or back to normal, then the stimulator is shut off. They don't need any more stimulation again because this is at its level that it's supposed to be. Keep that in mind. So hyperthyroidism and the thyrotoxicosis, this usually occur together because you're going to have a high level of thyroid hormone for this to occur. So subclinical hyperthyroidism, what you're going to see is a TSH level below 4.0, and I'm going to explain this to you. And this is one of the common things that student normally gets wrong. So let me ask this to you. Let me ask you this. Remember, I just explained to you that the thyroid produces T3 and T4. Remember that the thyroid produces T3 and T4. If this number, if either the T3 or the T4 is normal or high, they don't need to stimulate the pituitary gland. So what happens when someone has high level of thyroid? That means they have too much T3, T4. TSH is going to be low. The body is not going to send any signal to stimulate the pituitary gland. So in someone with hyperthyroidism, TSH is low, but T4 and T3 is high. The reason being is that the only time that the pituitary gland is stimulated to produce TSH is when these are low. But when they're high, it's not going to stimulate it. So with someone with hyperthyroidism, you will see a low TSH below 0.4. All right. Now, in the beginning, when the signs and symptoms of hyperthyroidism is occurring, you may see that these remain normal. But now when it comes, and this is subclinical, but when it becomes overt hyperthyroidism, that means it's getting worse, you're going to see a very low or undetectable TSH. Because remember, TSH is only produced when these are low. So if you have too much of T3, T4, you're not going to have any TSH because TSH stimulates the thyroid. Now, what you're going to see an increase in T3, T4, and symptoms may or may not be present. And we're going to talk about the signs and symptoms of hyperthyroidism. Here's how, let me clear this, and I'm going to tell you another way that I look at this. Here's another way that I look at this. This is the wife, okay? This is a wife, and the T3, T4 is her sex hormones. So this is the husband. The husband comes home, and the husband comes home, and the husband touches his wife in order to stimulate her. He touches her, she produces T3, T4. The T3, T4, the touching her is the TSH. The touching her is the TSH. So whenever the husband touches his wife with TSH, he stimulates her to produce T3, T4. But whatever is going on with the wife, she's already producing enough T3, T4, T3, T4. So the husband doesn't need to stimulate her. He doesn't need to take any roses. He doesn't need to buy her any Gucci bag. He doesn't need to buy her any Rolls Royce. He doesn't need to stimulate her because she has too much of this. So the husband doesn't have to buy anything. So TSH will be low. You'll see TSH levels low. You will see a lot more T3, T4, and you will see a decreased TSH because the husband doesn't need to stimulate his wife for her to be turned on with this because it's already high. This is the thyroid gland. What does a thyroid gland produce? T3, T4, right?
Mm-hmm.
Now, when does it produce and when doesn't it not produce? It is work to produce it. But if for whatever reason the levels drop, the amount of T3, T4 drops, it's going to send a signal to the pituitary gland to send something to stimulate it. All right, so I'm going to say this in this way to you. I'm going to take it from the pituitary gland to the husband and the wife. There's a husband and a wife living together. Okay? The wife has a very high sex drive, very high. The husband doesn't need to take flowers. He doesn't need to give her a card. He doesn't need to take her out to the movies. He doesn't need to do anything because her sex drive is already on high. This is hyperthyroidism. The thyroid gland, its sex drive, and just an example I'm using, is already high. The T3, T4 is already high. So this stands for TSH, thyroid stimulating hormone. They don't need to be stimulated. It doesn't need to be stimulated to produce this because it's already high all by itself. That's kind of abnormal. Very rare you find a woman who wants to have sex all the time, always ready. Doesn't matter where, doesn't matter when, they're always ready to go. This is hyperthyroidism. Very high TSH all the time. And they don't need to be stimulated by TSH. It doesn't need to come and tickle it for it to produce T3, T4. It already has its very high T3, T4, which said it could be caused because of cancer. It could be caused because of Graves' disease. It could be caused because of infection. But whatever the cause is, it's producing a lot of T3, T4, and it does not need TSH to stimulate it. That's hyper. Are we clear with that?
Yes.
The work of TSH is actually to stimulate this, to produce this. Just like the work of the man is to come home with flowers, is to come home with a gift for his wife, to stimulate his wife. This is a TSH. This is a gift that the man is taking home to stimulate the wife. TSH stimulate the thyroid gland to produce this. But when something is wrong, as if they have cancer, they have infection, they have Graves' disease, they don't need this to stimulate it. The thyroid by itself is producing the T3, T4, which is abnormal, I may say. Okay? So what we said, what is the etiology? If the thyroid Graves' disease, we said that Graves' disease is an autoimmune disease. It diffuses the thyroid enlargement. It causes the thyroid to get large, and the Graves' disease allows the thyroid to produce excessive amount of thyroid hormone, which is T3, T4. So Graves' disease causes, remember, and that's not normal. That's not normal. Autoimmune disease are not normal. The normal process is if T3, T4 are late or low, then it is the pituitary gland that should send the thyroid stimulating hormone to stimulate the thyroid. But in this case, it's not needed because the thyroid hormone, which is T3 and T4, is already high. This, as we said, is a causative factor, is interact with genetic factor. Women are 5 times more likely than men to develop Graves' disease. So what would you see? What is the manifestation? With this, it is the eyes that are bulging or exophthalmos. I don't know if you know Wendy on the Wendy Williams show, how her eyes are big. She have exophthalmos, which is caused by Graves' disease. So it gives the look as if the eyes are protruding because of increased fat deposit and fluid. The eyeball is forced forward. Now with that, because the eyeball is forced forward, sometimes the eyelid cannot close. So these people may have dry eyes, stuff may get inside their eyes. So look at her neck also, swollen, and the exophthalmos. Cardiovascular, because remember, one of the things that you have to remember is what is the purpose of the thyroid gland. The purpose of the thyroid gland is to increase, is for metabolism. Metabolism is what gives our body the temperature. If our body is cold or warm, it functions, it affects the heart rate, it affects the GI system. So if you have someone who have a hyper or excessive amount of thyroid hormones, T3, T4, then they may be experiencing hyperthyroidism. They will have systolic hypertension, they will have a bounding pulse, they will have increased cardiac output, they may have increased cardiac hypertrophy, you may hear a systolic murmur, and they may even have angina. In the respiratory system, this person may have dyspnea and mild exertion, meaning that they may be walking, they may have difficulty breathing. They will have an increased respiratory rate. For the GI system, they will have an increased appetite, they'll be thirsty a lot, they may even lose weight. The more someone's metabolism is high, is the more weight they'll lose. They will have diarrhea. They may have splenomegaly. They may have hepatomegaly, which is enlarged spleen and enlarged liver. The skin, they may be warm, or some people may even complain that they're hot. The skin will be smooth, moist, thin, brittle nail. The hair will be lost. They may have clubbing of the finger. They may even have redness in the palm of their hands, fine silky hair, premature graying in men. They may have diaphoresis, means sweating. Vitiligo is like the skin may have a clear patches on it. Now, acropathy. So this refers to dermopathy, and this is associated with Graves' disease. It is characterized by soft tissue swelling of the hands and clubbing of the fingers. So if this person have Graves' disease, remember, it's a predisposing factor for someone to have hyperthyroidism. So manifestation, what you see, continue. Musculoskeletal system, they'll feel fatigue, they'll be weak, muscle wasting, they may have dependent edema, they may even have osteoporosis. For the nervous system, they may have hyperactive deep tendon reflexes, they may be nervous, fine tremors, difficulty sleeping, because when someone's metabolism is high, is that they're constantly having a lot of energy, so they're burning without even doing any exercise. It's like they have a machine working constantly very hard within their body, and that's why they lose weight, and that's why they can't sleep. Difficulty focusing their eyes. They may have swinging mood, they may have delirium, they may lack the ability to concentrate, they may be even in stupor, even going to coma. So this is a very good picture that will tell you what you will see with hyper, because remember, it's like they have a factory in their body giving off a lot of steam, working up, high increased metabolic rate. So the reproductive system, the woman will have irregularity in her menstruation. She may have amenorrhea, and we talked about this yesterday. Amenorrhea is not having any period. Decreased libido, decreased fertility, impotence, and even gynecomastia. Gynecomastia is breast enlargement in male. Heat intolerance, can't tolerate the heat because they're already hot without even doing anything. Elevated basal temperature, lid lag, staring, eyelid retraction, because the possibility they could have the protrude eye, which is called the exophthalmos. Rapid speech. Rapid speech is also a possibility. Acute thyroid toxicosis. So now this is hyper, but this is going into extra hyperdrive. This is where an excess amount of hormone is released. This is a life-threatening emergency. Death is rare when treatment start early. So if you can identify them with the hyperthyroidism level before they reach to the thyrotoxicosis, then their life can be saved. This results from stressor. Thyroidectomy patients are at risk. Manifestation, they may have severe tachycardia, heart failure, they may go into shock, they may have hypothermia, which is high temperature, they may have agitation, they may also have seizure, abdominal pain, vomiting, they may even go into a coma. So what are the diagnostic studies? Decreased TSH. You're going to find out that TSH level is decreased, because remember, TSH is the thing that the man take home to give his wife to stimulate her. This is the TSH that stimulates the thyroid gland. You're going to find out that someone with hyper level of thyroidism, like a high sex drive, don't need to be stimulated like the thyroid. So this would be less than 0.4. You will see an increased free thyroxine, which is T4, that is not bound to any protein. You will also see total T3 and T4 level, which may also be decreased, but is not definitive. Radioactive uptake iodine. This distinguished Graves' disease from other form of thyroiditis. For example, you want to know what's causing this person to have hyper. Is it Graves' disease, or is it inflammation of the thyroid, like thyroiditis? Interprofessional care. So the goal is to block adverse effect of the thyroid hormones, suppress the hormone oversecretion, like what's causing it, prevent any form of complication. There's 3 types of primary treatment. They can give them anti-thyroid medication. They can either do a radioactive iodine therapy, or they can do surgery. Okay? And so with surgery, it removes the thyroid. But remember, When you remove the thyroid, what's going to happen is now they're going to go into hypo. And so they have to be on medication for the rest of their life if they're going to remove the thyroid. And that is another thing too. How do you look after individual patients who has high thyroid level and have to go into surgery? So another thing that they can do is to give them a medication that reduces thyroid level in the body. It's actually called PTU, topazole. Topazole is one of the medication that they give to reduce the thyroid hormones. So I did say that they can give them anti-thyroid drug, which I just mentioned, topazole. They can give iodine, beta adrenergic blocker. They can also give that to help with the heart rate. Here is the PTU that I mentioned, the topazole. It inhibits thyroid synthesis hormone. It prevents the body from making the T3 or T4. This, they will see some improvement in 1 to 2 weeks. Results usually seen within 4 to 8 weeks, and therapy for about 6 to 15 months. For iodine, they will give them potassium iodine or Lugol solution. It also inhibits the synthesis of T3 and T4 and actually blocks their release into circulation. That means it prevents T3 and T4 from circulating. And remember, what causes hyper is the increase of T3, T4. So it decreases the vascularity of the thyroid gland, making surgery safer and easier. So they may give the iodine prior to surgery. Maximal effect you will see within 1 to 2 weeks. With the beta adrenergic blocker, this is symptomatic relief for someone who is going into crisis like the thyrotoxicosis. It blocks the effect of the sympathetic nervous system. So it decreases someone who have tachycardia, someone with nervousness, someone with irritability, and someone with tremor. Medication is like our tenofovir, like our atenolol, or our Inderal, such as our propranolol. For iodine therapy, the treatment of choice for most non-pregnant women. So it damages or destroys the tissue of the thyroid. There's a delay response for up to 3 months. They normally treat with the anti-thyroid drug, and they may also give beta blocker before and even during the first 3 months of the radioactive iodine therapy. This is given outpatient. The patient teaching, you want to teach about oral care for those who have what we call thyroiditis or parotiditis. Radiation precaution, because someone who receive radiation, they should not sleep with their husband or family member for a couple of weeks after receiving radiation. And because the radioactive iodine actually damages the thyroid, now if it damages the thyroid, instead of having a hyper, now they may have hypothyroidism. So you need to monitor for low signs and symptoms of hypothyroidism. So for surgery, those who have a large goiter and it's compressing on the trachea, because the trachea is what we use for breathing. If someone is getting the medication such as the anti-thyroid therapy, they will do surgery. If they have cancer, then they will do surgery. If they cannot get the radioactive iodine, then they will do that also. Rapid reduction in T3, T4 level after the surgery, because remember, they're removing the thyroid gland that make the T3, T4, so you're going to see a rapid reduction in that. There's something called a subtotal thyroidectomy. This is a preferred procedure, and it involves removing 90% of the thyroid. It can be done using minimal invasive procedure. It can be done using an endoscopy or robotic surgery. So here is the thyroid. So this is a larynx, this is a trachea, this is a thyroid. And what they will do is they will cut it in half and they will move part of it. It's called subthyroidectomy. Okay. Nutrition. Now, high caloric diet, 4,000 to 5,000 calories per day. They need to take about 6 full meals daily with snack in between. Protein should be 1 to 2 kilograms per ideal weight. One, avoid any kind of high seasonal or high fiber food or caffeine. This person should be referred to a dietitian if they're having any issues. For the nursing assessment, now as a nurse, remember I mentioned yesterday that there's a subjective data and there's an objective data. Subjective data is what you get from the patient. The patient may be saying that, I noticed that I have a swelling in my neck. They may complain of a recent infection or trauma or immigration from iodine deficient countries. You have some here in the United States, they have iodine in the food, so that there's a decreased amount of people in the United States with iodine deficiency, but you have some countries who do not do that. So this person may come from a country that has their food are not fortified with iodine. Or this person may have an autoimmune disease like Graves' disease that I mentioned. Medication, thyroid hormone, and herbal therapy. So remember, a person, if they have any, you have a total thyroidectomy and you have a subtotal thyroidectomy. If you have a person who had their entire thyroid removed, then they're going to need to be on thyroid medication for the rest of their life. If it's only part, then they can live and function without any thyroid medication. For nursing assessment, subjective data, you want to take family history, iodine intake, their weight, about their appetite, if nausea and vomiting, any polyuria, any diarrhea, any sweating. In addition to that, you want to find out, is there any kind of, difficulty, which is dyspnea and exertion? Do they have any palpitations? Do they have any muscle weakness or fatigue? Any kind of insomnia, chest pain, nervousness, any heat tolerance, any itching? Do they have any decreased libido? Because these are signs and symptoms of hyperthyroidism. Decreased libido, libido meaning don't have the interest of having sex. Impotence, gynecomastia, which is enlarged breast, amenorrhea, not seeing a period, no period, emotional, irritability, restlessness, any kind of delirium, meaning confusion, and kind of personality change. Now, objective data is what you, the clinician, is going to see. Is this patient agitated? Is there a rapid speech? Is there anxiety and restlessness? Does the person have a high temperature? Is there any kind of enlarged goiter? Is the person eye protruding, as in exophthalmos? Is the eyelid retracted? Eyelid retracted because the eyeball is protruded out the head. The eyelid is back into the head, so it's difficult to cover the eyeball. Is there infrequent blinking? Infrequent blinking because the eye is protruding, the eyelid cannot cover the eyeball, so they will have infrequent blinking. Warm, or the diaphoretic, sweating. Do they have any kind of velvety skin, which is thin, smooth skin? What about their nail? Is their hair silky, fine? Do they have any hair loss? Do they have any kind of erythema in the middle of their hands? Any clubbing of the fingers? Any edema? All of this are signs and symptoms of hyperthyroidism. Now you want to check for tachypnea, dyspnea, tachycardia, murmur, hypertension, bruit, increased bowel sounds, increased appetite, diarrhea, weight loss. They may have hepatosplenomegaly, which is the hepata is liver. The spleno is actually the spleen. So we're talking about enlargement of the liver and the spleen. Any kind of hyperreflexia, meaning that when you tap on the knee, the foot flex very fast and quick. Any kind of double vision, any fine tremor, any muscle wasting, any irregularities with menstruation, because remember, they can have irregularity or they can maybe not see their period any at all. Infertility, impotence, and gynecomastia. They will have increased T3, T4. That's what you will see, because remember, T3, T4, the increased T3, T4 is why they have hyperthyroidism. Decrease or undetectable TSH. The reason why, remember, in hyperthyroidism, TSH is going to be low because it don't need to be stimulated. It's already producing enough. Chest X-ray may show that there's an enlargement of the heart because of the TSH. You have increased heart rate. EKG may find tachycardia. In terms of nursing diagnosis, you could have activity intolerance, impaired nutrition, and lack of knowledge. So the goal is to have a relief of the symptoms. You want to have no serious complication related to the disease or the treatment. You want to also make sure maintain nutritional balance, cooperate with therapeutic planning. Now, for the nursing implementation, you need to know the difference between what is nursing diagnosis and what's nursing implementation. A nursing diagnosis is built from the medical diagnosis. So you look at what are the signs and symptoms the patient are maybe facing. Remember that a person with hyperthyroidism, they have dyspnea and exertion. So because of that, a nursing diagnosis will be activity intolerance. So that's just an example. So what are you going to do with a person who is in acute thyrotoxicosis? Aggressive treatment is needed. You want to give medication that blocks the thyroid hormone production. You want to monitor dysrhythmia. You want to ensure adequate oxygenation, fluid and electrolyte replacement. You want to establish trust and relationship. You want to ensure adequate rest. So it must be cool, quiet room, light bedding. You don't want to give them any blanket or any thick cover because they're already hot. So you don't want to give them any thick covers. Change linen often. You change the linen often because they're sweating. So as it relates to the nursing implementation for the perioperative, remember that this person is going to have surgery. One of the treatment is surgery. You want to give medication to achieve euthyroid state. Remember that a euthyroid state meaning a neutral thyroid state. So before the person going to surgery, you may give them topazole. Topazole will get the thyroid level down. You will see changes within 1 to 2 weeks, but you won't see the great or the effect until about 4 to 8 weeks. Give iodine to decrease any vascularity. So if the thyroid is swollen, sometimes they don't want to have surgery on the neck when the thyroid is that swollen, so they may give iodine to decrease the size. Teach the patient comfort and safety measures. Leg exercise while they're sleeping because you don't want them to have a DVT. Support the neck because remember, support the head and neck range of motion. This person is going to surgery to take out their thyroid. Routine post-operative care is given. So for post-operative, after the surgery, monitor for hypothyroidism. Now remember, the thyroid, which normally produces T3, T4, is taken out. So no, it's not that it's going to be high. It may be low because they removed the thyroid. One thing that's on the thyroid that I didn't show you, I'm thinking that maybe she will have another PowerPoint. On the thyroid, they have something called a parathyroid. So it looks like this. So this is a thyroid, okay? Oh my gosh, let me draw it better than that. This is a thyroid. On the thyroid, you have 2 glands up here. They're called the parathyroid. They actually produce calcium. So during surgery, sometimes you're accidentally removed, and so you will see low calcium level. All right, it can affect the heart. It can also cause twitching of the face. You'll see twitching of the face, which indicate that they have a low thyroid level. You should look over the laryngeal nerval damage too, because they're going where that nerve is. Look for infection and look also for thyrotoxicosis infection. So patent airway, you want to make sure that oxygen suction equipment, tracheostomy tray in the patient room, just in the case that this person airway should close up and this is a priority, you can intervene. Monitor for any kind of stridor, difficult or sounds stridor from the patient because of airway occlusion or swelling. Have IV calcium readily available, because I told you that because the parathyroid is on the thyroid hormone, they can have hypocalcemia, which can cause problems. So you want to make sure that you monitor for that. For the implementation, continue with post-operative care. You want to assess frequently during the first 24 hours for any hemorrhage. If you look at how someone's neck is, if someone is laying down and they had surgery, you may not see the blood coming through the gauze. It may slide to the back of their neck. So you want to make sure that you look behind the neck on the pillow or on the bedding if you see any blood. Semi-folded position, support the head with pillow, avoid any kind of tension on the suture, monitor vital signs, monitor for signs of hypocalcemia, because remember that they can remove the parathyroid glands, and so you want to monitor for that. The person should get up and walk. Psychosocial support should also be given. Discharge. You want to monitor the hormone balance periodically, decrease caloric intake, because now when the person had hyperthyroidism, their body was burning up the energy very fast. So they had to take in, their nutrition is needed to support that. Now their thyroid is removed, then you don't want to eat too much calories. You want to avoid excessive iodine intake, regular exercise, avoid high environmental temperature, regular follow-up. The discharge teaching should be regular follow-up, complete thyroidectomy. If they need a complete thyroidectomy, like I mentioned, a complete would mean that they move both sides of the thyroid glands. A subtotal would mean that they remove only one side. After surgery, they should be monitored for hypothyroidism. It's like you have a lot of money in the bank and someone removed the bank. No, you don't have money. It's the same concept. You have your thyroid producing too much T4, T3, T4. They remove it. Now you're not producing any. So this person would need to be on thyroid medication, most likely levothyroxine or Synthroid, and this would be needed for life. When someone is taking Synthroid will be taken first thing in the morning. Synthroid is like a synthetic T3, T4. Now they remove the thyroid, they don't have any more thyroid, they have to take a pill to replace it. So this pill should be taken first thing in the morning. Here is why. Because T3, T4 give you energy and increase your metabolic rate, you want the person to have the pill throughout the course of the day to have their metabolism going. If you give them the pill at night, their metabolism rate is going to be high and they won't be able to sleep.